Welcome to Every Animal Has an Owner, a mostly large animal podcast for veterinarians and the people that depend on them.
I'm Dr. Amanda Jones. I am from Texas, where I work as an ER veterinarian, and I also like to help rabbits in the state of Texas part-time working on their vaccine protocols.
I'm Anthony Pilny. I work at Arizona Exotic Animal Hospital, where I serve as the medical director and the director of our education programs. We are a 100% bird and exotic pet veterinary hospital.
I think the biggest thing that we've learned about RHDV2 is that it's not going away. Regardless of whether or not we are testing as frequently as we did at the start of the outbreak, we are continuing to see persistent cases in the West and persistent cases in pet rabbits throughout the United States. So we need to be aware that this is going to continue to be a thing, and we want to really promote vaccination as part of that to protect all rabbits across the country.
And what we've also learned is surprising to most people is that although we accept that the disease is present now, we know it's present in wild rabbit populations, and there are continued reports often of new counties or new cities or new locales where cases are found. We know that with our acceptance of the disease being here, there's been a decrease in testing sort of by our state veterinarians.
And you know, speaking of states not testing as frequently, I'm reminded of a conversation I had last spring with the state vet for the Texas Parks and Wildlife. We had a recent case in South Texas, and there was a little bit of confusion about which lab did the test and some of the results. So I called and spoke to her personally about that county testing positive, and she reassured me that yes, we have in fact seen RHDV2 in that South Texas county, which is the furthest we have seen RHDV2 in Texas, the furthest south we have seen it. But then she went on to tell me about, oh yeah, we've actually suspect RHDV2 is in twice as many counties as we have actually tested. We get reports all the time, but ranchers either don't know about the disease, or by the time they reach out to us and talk to us, the condition of the wild rabbits they have found aren't in testable condition anymore. So they can't even run the test, even though they've had a mass mortality event documented. And due to the nature of reporting, a mass mortality does not warrant us labeling a county as RHDV2 positive. We're just going to be suspicious that it is in fact present. And in Texas, for one, we have two different organizations in the state managing our populations. And I think the same is for a lot of the Western U.S. We have the wildlife organizations, and then we have the animal health commissions or the domestic livestock commissions managing the diseases. And a lot of times, those two agencies do not talk. And we had a big issue with that in the South Texas case. The Texas Animal Health Commission didn't realize we had wild positives in South Texas and had told owners we don't have RHDV2 there. When we knew from the Texas Parks and Wildlife, yes, in fact, we do. And it caused a huge confusion and a lot of concern for owners with the fact that these two organizations hadn't talked to one another.
When the disease is known to be in a state, when we know wild rabbits are dying from it, when we see pet rabbits die from it, the state veterinarians are a little bit less quick to test for it and confirm cases. We've even had clinically suspect cases in the hospital that have been slightly challenging to reach somebody to test, when 2 or 3 years ago they would have been there the next day. So we've learned that it's still present. It's hard to have any concrete data because the testing for it is slowed down significantly. And I think we know that our expectations that it would have spread across the entire country have not happened. And I think that's been sort of a surprising fact when we think about how this disease has spread in like Australia and other countries. And it's sort of hanging on the western half of the United States with isolated cases in other areas, and still some states where it's not been reported.
I was talking to a 4-H agent out in West Texas. She didn't know what RHD was, and she was telling me, yeah, we're looking to get in some new breeding stock because after our county fair last year, everybody died a week later.
God. And they don't know why?
And they don't know why. And I'm like, well, I have a few ideas.
Right. Yeah, I actually just got a message on social media from an old vet tech that I used to work with years ago, who reached out and said, can I run a really challenging rabbit case and pick your brain with it? And I said, go for it. I don't know that I can help, but let's try. And it was somebody that had something like 11 pet rabbits outdoors, and 6 of them have died in the span of a week and a half. And so one of the top differentials I'm going to think is the possibility. So immediately, were they vaccinated? No. They've started vaccinating since they're dying. So I'm like, okay, so then we had that on the radar, but what are we doing? And 2 of them got sent to pathologists and came back with non-specific liver, not necessarily the classic histologic findings, but enough with the liver, congestion, mild necrosis, portal inflammation, things like that. And I'm like, you're seeing liver things and you're seeing a die-off. It's not dietary, it's not environmental, it's not a toxin. Like, something else has to be going. If it's taking that many, I would really be worried about infectious. And so they were replying that, they hadn't really thought of it. They weren't previously vaccinating. They weren't familiar with the disease being as much of a problem. And I was like, I would have a serious consideration that could be what's going on, especially if you lose more of them.
I have seen with necropsies that I have had sent off that some pathologists are really savvy with rabbit medicine.
Right.
But a lot of them will come back with, well, we really couldn't tell what was going on. Here's some non-specific findings. And then they just stop. They don't investigate further. They don't ask for microbiology to be done. They don't necessarily have RHDV as a flag if they're seeing liver changes on histopathology. So you sometimes have to go back and ask, hey, do you think we need to talk and send this off?
And I told her, I said, before we have any more conversation or I invest any more time in it, I want you to let me know they're RHDV negative before we try to figure this out further. I think that's one of the first things you need to rule out. So that, supports what we're talking about here, the pressing need to be aware, to recognize the disease, and to continue our preventive measures, which of course include vaccination.
I think that people often will forget about things that they don't hear about frequently.
And so basically, the lack of coverage, the lack of discussion, the lack of something being in the media, the lack of pet groups and organizations discussing it, since we've kind of moved past this new disease and we have this disease in rabbits in this country, is sort of where it is now. And I think that's part of what we've seen is the buzz die down to some degree. It's just not as talked about, it's just not as covered. It's known to be here, and it's something that we know we can work towards prevention with vaccine and biosecurity, but it just doesn't get the press coverage.
We really don't want to forget about it.
Right.
Just because we're not hearing about it. Anytime we have a disease that often will end in fatality is always a disease that we want to promote for vaccination.